I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing really good. Today we are going to talk about acne management. Now, acne is something which keeps on bothering most of us. Very well managed acne, and this is why we are here to talk about acne management. Now, our guest for today is Dr. Shruti Kharbanda, MD, MBBS, who is a highly qualified dermatologist with over 5 years of dedicated experience in treating various skin conditions. Specializing in dermatology, Dr. Kharbanda is renowned for her compassionate and effective care for various skin-related conditions. Her commitment to patient-centered treatment ensures that each individual receives a customized approach tailored for their specific needs. And affiliated with Apollo Hospital in Indraprastha, she collaborates with a team of leading specialists to provide comprehensive and holistic care. So today our guest, Dr. Shruti Kharbanda, will join us shortly. As the topic of this discussion, this conversation is going to be acne management. And viewers, if you have any questions related to the acne, please feel free to write to us in the comment section, and we will try to take up your question as well during our discussion. So today we are going to talk about acne management. As a teen or as a young adolescent, most of us has gone through that phase of acne vulgaris. And we don't know what to do about it, where to go, whom to talk about it. Mostly, with my experience, I can say when I went to approach my parents, they said that it's a very natural thing, which is right. They say that it is good because you are growing, so it's a symbol of that, which is true. But then many of our parents don't take us to a qualified dermat. So it's important to understand why it is important to go and consult a qualified dermat, even if it's during our teens, the very natural puberty, we can say acne. So it is important because acne will subside one day. That is correct. But then the post-acne inflammatory marks or scars, they are so difficult to get rid of. So it's important to talk about it. It's important to know what to do, and most importantly, what not to do. So acne management is going to be our topic for this session, and we'll try to understand how to go for a good skincare regimen, which we can be more consistent with, which can make our skin barrier, more strong, and we can prevent having acne, and what to do in case we have these acne issues. So what to do, where to go, and how to get the right approach to manage acne. So one very important aspect is also to understand that we need not fall for any home remedies or over-the-counter topical applications, over-the-counter medications, or DIYs by various social media influencers in case we have chronic acne issues, because it's important to understand first of all that what is causing these acne. So it's more important to understand why acne is happening, what is the reason, what is the cause, and how to take care of it. So acne management is our topic for today, and Shruti Kharbanda, our expert, is going to join us shortly. So if you have any questions, please feel free to talk to us, to comment us, and ask what queries you have related with acne management. Another very important, question we often get to hear is that, do diet has anything to do? Eating right is important. We all know eating healthy is important for our overall health, including our skin. But what to avoid in case we are having chronic acne? Do sugars or chocolates or deep fried stuffs really contribute in making the acne even more worse? So this is also going to be one of our sectors that we would like to comment. And yes, girls especially who want to know, can we apply makeup or not? Because that's again a very common questions that we keep on getting. We'll also try to cover that topic as well. And especially if you have a oily or acne-prone skin, how to take care of your skin, what are the basic, skincare things that we need to go for, how to make our skin, barrier more strong is going to be our topic that we would like to cover. And here we go. We have with us Dr. Shruti Kharbanda. A very, very warm welcome to you, Doctor. So, Doctor, to start with, what is acne? What are the various grades of acne and why it happens?
So, the causes of acne there can be many causes of acne. Nowadays, we're seeing hormonal acne, uh, you know, people having acne after adult acne, which is usually acne after 30 years of age. That has seen a splurge a lot in this day and age, especially after COVID. So we are seeing a splurge of this now more. So earlier it used to be just limited to the teenage, but now we can see that it is more even now, like after the age of 30. So that is a major change that has happened epidemiologically.
And Doctor, because we are talking about
Yeah.
acne and other than, teenagers or adult acne patients, even those who have a oily or acne prone skin, they are so, in a way pissed off with this issue because it's so chronic. Every now and then they keep on getting these acnes.
Yes.
So my question to you is there a very basic, very minimalistic skincare regimen that we can go for to make our skin barrier more strong and in a way we can prevent acne? Is there any basic minimalistic more that's something that we can be more consistent with skincare routine?
Yeah. So skincare routine is basically it comprises of three parts. One is your diet. Okay, that is very important. So what is happening inside your body is going to reflect on your skin. So skin is a
Right.
part of, it's one part of your body. So whatever is happening, especially in you must have heard about gut health, right? So whatever is happening in your gut reflects on your skin. And
True.
sometimes like a patient can be walking inside and we can get to know right from the skin what the person is suffering from inside without them even telling us any history, or without us examining them closely also we can tell what probably would be going on inside the person's body just by looking at the skin. So skin is like a window
Mhm.
to your inner body. So a good internal environment, internal milieu of our own self, that is very important for skin.
Right.
Secondly, a skincare routine is very important, which comprises of a basic, moisturizer, lotion, cleanser, and apart from that, any active ingredients that we give. And the third is, of course, procedures. So in this day and age, all three combined can lead to a good skin health. Just like you go to the gym for building your muscles and having a good health, in a similar way your skin needs good nutrition from inside, good sunscreen moisturizer from outside, and then a step further we have so many procedures in this day and age which are medically good and they are approved by dermatologists.
Right. So this is a very clean, minimalistic skincare routine
Yeah.
which we can be more consistent with, and that will make our skin even more better. But after a very very common obsession in our society is of home remedies or DIYs. These days, these influencers on various social media platforms, and most of them are not qualified dermats, but still they have so much to talk about skin and scalp.
Yeah.
So they'll tell us, apply this, apply toothpaste, apply garlic, apply lime water, whatever. And we are falling for it. Then we have these nearby chemist shops, which are so easily accessible,
Oh, yeah.
available. We go to them, कि भैया देखो कुछ हो गया, pimple हो गया, कुछ दे दो. And that's when we get those topical applications. And again, we fall for it because initially they work like a magic cream. So what's your stand on these DIYs, home remedies, over-the-counter topical applications?
DIYs and home remedies are, okay just for a feel good factor. That's about it. So if there is something going on with the skin, if you want to improve, the skin quality, then I go for a medicated treatment, a medicated skin routine, because sunscreen cannot be replaced by anything that is a DIY. Sunscreen needs a proper medicated sunscreen inside of it. So I always, prefer a proper skincare routine. And DIYs and home remedies can obviously be just done, for a feel good factor. That's about it. And coming to the over-the-counter, things that you that are available at any shop that you go to or any chemist. So I would not suggest that, because there are a lot of times, you will not find that. Like if I'm suggesting to you vitamin C, or if I'm suggesting to you retinol, you won't know if that particular thing that you're buying actually contains retinol or vitamin C. So that's why I only go for dermatological products, which I know that they have that particular ingredient in it, and I know that it works. And these things need to be taken care of. So I don't, and obviously you can't just throw anything on your face and just think that it's gonna work. Not at all. Tried and tested things, and things that have a medical grade, those I would go for.
Right. So the bottom line is, in case you have any skin-related issue, even if it's an acne, please go and consult the right person at right time,
Yes.
which is a qualified dermatologist. Don't fall for your paros wali, parlor wali auntie or your nearby chemist shop. Don't do that. Go
Yeah.
to the right person, because they have actually studied a lot, given their life years in studying your skin and issues.
I'm so
So,
glad you brought this up, because the thing is that skin is not just a separate entity. Like it is it is interrelated with all the organs of our body. So it is a medicine. It is a part of medicine, and we know how to treat it in a preventive way and a curative way as well. Both are important. Preventive medicine is important, and curative medicine is important. So whether if your skin is not that great, and if you just want a normal skincare routine, then we do that. Plus, you are suffering from something like an active skin condition, then we help to cure that skin condition. Not just seeing the skin, but curing the root cause, that what might be causing that from inside. So we treat it as a toto, as uh,
right.
how you would treat anything else in your any other organ of your body. So we need to see it in toto. So that is what we do, and for that you obviously need an in-depth knowledge, which you can only get to know if you've studied through the years, and you know how your body is working and how it's responding, and how you've clinically seen things panning out over the years.
Absolutely. If we get chest pain, or we are wondering that something is not probably right with our heart, we won't go to anybody. We won't go to a chemist shop that I'm probably getting a heart attack. Please give us something. We'll go to the right person, which is a cardiologist, or at least to our physician.
Yeah.
But with skin, we are probably so lenient that we will try everything else rather than going and landing up in front of a doctor. So yeah, so the right thing is to go and consult a doctor. Again, a qualified dermatologist is where you need to go in case you have any skin-related issue. The doctor, as we have already discussed about a good skincare routine and why it is important to go to the right person, which is a qualified dermat, rather than going falling for anything
Yeah.
else, we would also like to understand that in case we have acne, many times people say that probably you eat a lot of sugar or chocolates or dairy products. Dairy products is one thing that people normally say is not good for acne. So is there a correlation? Because what we need to eat is okay, but what we need to avoid in dietary, any dietary precaution for that?
Yeah, totally. So milk is a total no-no for milk, and milk products are a total no for acne. And why that happens is because nowadays, firstly, there are a lot of ingredients that are mixed in the milk that we don't know. There are milavate, so we don't what can interfere with our own body. Secondly, like milk has prolactin, right? The cow's prolactin. So that interferes with our own hormonal axis. So it has been proved that, like milk is not dairy products should be totally avoided in acne. And not just that, but even whey protein, and any sort of uh, artificial sweeteners, they should not be taken. Apart from this, so if you like, a little bit is fine. Like I'm not totally restricting you. Like if you want to have that 1 cup of coffee or tea in the morning, you can totally go for that. But apart from that, you should not have anything in excess. And sugar, definitely, sugar causes a spike right in the body, insulin spike, and that would lead to insulin-like growth factors, which can can disrupt the and they support this pathogenesis of acne. So that also should not be taken. So artificial sweeteners, milk products, and you have excessive sugar that should not be consumed, especially abhi Diwali time, so much, I've seen so much acne coming, much stuff like that. So that, and anyone who has acne should not apply too much hair oil. And these are a few precautions that one can take. One,
Fair.
if one's prone to acne. Other than
Right.
that, everything in moderation is fine.
Absolutely. Now, doctor, talking about the treatment, how do you treat acne and how do you treat post-acne pigmentary marks or those pits and scars? Because acne eventually will subside, but then those scars looks like they will be forever, ever and ever.
Yeah.
So, what are the treatment options available?
So to prevent acne scars, the first thing is treat your acne early so that the scars, once the scars form, they're very stubborn and they're very difficult to treat. So anybody who's coming to us with acne, like first initial 2 months, we will focus on the acne itself. So we will try and do everything to minimize the inflammation by acne. We'll try and minimize the, the comedones, the inflammation, and the number of acne, the frequency of it appearing. So we try and diminish that within 2 to 3 months. And if there's any cause, behind it. So if you're treating the acne, like hormonal causes, which is the most common cause in women after 28, 30, causing acne. So you need to resolve hormonal things as well. So for that, again, you start by your diet. So anyone who's suffering from hormonal acne can have peppermint tea, or can, nutrition wise, you can do things to help your regularize your hormones. You can have jeera, ajwain, soft water. You can like put it overnight, strain it in the morning, and have it at a fixed time every day. That really helps with the hormonal aspect. Exercise every day. Exercise comprises of both muscle strengthening and cardio. Both are important. Little bit of both, not excess of both. So that is important. Apart from that, so these are things that will help with the nutrition aspect and the dietary restrictions that I told you. Then comes the medical grade treatment. Of course, we give medications to help resolve the acne in time. We give a few topical things to apply. Again, just applying a couple of tubes topically is not going to help treat the acne, so it has to be treated in toto. And then we have procedures, that would help with the active acne. Nowadays, there are a lot of procedures like chemical peeling and laser that help with active acne. Now comes the pigmentation part and the scar part that happens after the acne disappears. So that also, it's very, there are not many things that you can apply on your face for treating scars, because scars is ultimately the collagen that gets formed. There are collagen fibers that get formed. So we need to disrupt the collagen fibers. That happens mostly with physical modalities like there is subcision for acne scarring. There is subcision. There is again, you have micro needling now, also very common, very helpful. It basically it helps to stimulate the collagen, or the fibroblast to stimulate collagen generation in our skin, which will help remodel the scars. So this is also very like a gradual process. Again, like going to the gym, it happens very gradually. That's why I told you that treating scars is a very stubborn thing. So the best thing is to prevent scars to form in the first place and get treated. When you find out that you're suffering from this, you should take the treatment early on and not try your own things. Just leave it to the professional and get treated early. But then, if you have reached that stage that you have scars and pigmentation, then we have things for that as well.
Right. So don't take your acne to that stage where you are sure of having those scars or marks.
Yeah.
It's better to get them treated at the right time and avoid having those scars. And even if you have those scars, again, please go and consult your doctor. That's really important. Go to your dermat. Now, doctor, many times people often ask that can we apply makeup in case we have acne? Especially, in some professions, makeup is a necessity, with a air hostess, actor, anchor, etc. and they don't know how to, manage.
Yeah. So it's not a problem. There is a type of acne called acne cosmetica. So in that, so basically that causes that. So when you apply cosmetics, so what happens is the pores get clogged, and that leads to the exacerbation of acne. So there is a certain percentage of acne that gets formed due to cosmetics. But I think if it's sometimes necessary, I don't see any problem in it. If you're applying it for less than 4 hours, don't apply it more than 4 hours, is what I'd suggest. And I think it's fine, if you apply a good quality brand, uh, not a like something that harm your skin, but a good quality brand makeup, and you apply it for less than 4 hours, I think it's fine. It's not a problem. It's not too much of a problem. Yeah.
Right.
If you're doing
Initially,
sweating, or you're going out for a run or something like that, then you shouldn't then you apply any makeup or like heavy sunscreen or something that would clog the pores and would cause more. It might lead to aggravation of acne. That is one instance where you should.
Doctor, because you have already mentioned that how important it is to choose the right moisturizer, cleanser, sunscreen as per your skin type.
Mhm.
When we go out specifically to buy a moisturizer and sunscreens, there are so many informations written on the, tube
Yeah.
box, bottle, whatever. So, what are the basics to look for in case we have a oily or a acne-prone skin in sunscreen and moisturizer?
If it's gel based, I think it's fine. So there are sunscreens for acne prone skin, and then there are sunscreens for dry skin. So one should definitely choose a sunscreen for both acne as acne prone. If you have an acne prone skin, then choose an acne savvy sunscreen, and same with moisturizer. But moisturizer is essential because acne is not, it is a barrier disruption. So people think that don't apply moisturizer because of acne, but it is important to apply a moisturizer. So they'll apply lots of salicylic face washes and totally dry out the skin, and it won't help. You need to maintain that balance. You need to moisturize also in acne. So there are moisturizers that are acne savvy. So you can definitely, sunscreen and moisturizer is a must. And right now, so I in Delhi. I mean, right now winters are gonna come, so moisturizing of the skin is required, especially during
Right, right.
the pollution and all.
Absolutely.
Yeah. Apart from this, double cleansing of the skin. So removes any that removes macro particles. So double cleansing is a technique that has been taken from the Korean skin care, but it is it's a really hot topic right now. So that comprises of cleansing your skin twice. So like the first has to be with an oil-based cleanser, and the second has to be with a water-based. So an oil
Okay.
cleanser can be oil as well. So oil dissolves oil. So you need to dissolve the macro first. So
Right.
sebum, all the dust right now, the air pollution is going crazy in Delhi. So that I double cleanse, especially if you're living in the northern part of India right now. So and that'll remove all the macro particles like dust, sebum, sunscreen, makeup, anything like that. And then the second cleansing would actually cleanse the skin. So these two parts of cleansing is very important. If you can't do it, like, of course, twice, you can just do it once, and that's enough. Yeah.
Okay. And doctor, before we wind up, any take-home message for our viewers?
Just keep your gut healthy. Have good nutrition that will lead to a good skin. Have a good gut health, and good gut health means eating your seasonal fruits, vegetables, eating things that are local to your area, eating fermented foods. There are lots of varieties of fermented foods nowadays: idli, dhokla, sour bread, whatever suits your taste. But have a lot of fermented foods in your diet. Yeah, maintain a low sugar intake. Not take lot of these protein powders. And I'm not saying that it is unnatural, but there are enough evidence that it can, like in our clinical practice also, we see that it can really cause havoc. So just stay natural, and have your protein in your diet itself. Have a good nutrition that would solve half of the problems of your skin. And yeah,
Right.
take home message: maintain a good gut health. That is very important in this day and age.
Absolutely. Thank you so very much, Dr. Shruti Kharbanda. It was wonderful talking to you. Thank you for making this session so informative. Thank you so very much.
It was great talking to you as well. Yeah.
Thank you. Pleasure. Pleasure, doctor. And viewers, thank you for your active participation. Stay happy, stay healthy, and stay connected with us. Have a great evening ahead. Goodbye.
And bye.